The next speaker is Dr. Carina Price. Carina is a research fellow within the University of Salford. She's a sports scientist by background, and her research surrounds the biomechanics of the foot and footwear. Today, she will be speaking about the integration of footwear research into product development.
Thank you for the introduction, Jenny. I'll skip my first slide because you've done that for me. So firstly, I'd like to acknowledge the data that I'm going to talk about in the project. This comes from 4 KTPs that were undertaken over the last, well, now 12 years within the department. Firstly, KTP with FitFlop Limited, which I was the associate for. So the reason I came to Salford with lead academics of Dr. now Professor Richard Jones and Dr. Phil Graham-Smith. The Tafeln KTP, a Weratech KTP and a Clark's KTP. So the Tafeln KTP finished a few years ago with Jennifer Anderson as an associate. Max Lewin then overtook some of the work and continued some of the work and developed the work with the company changing the name to Weratech. And Michael is currently in post at Clark's looking at kids footwear. These were headed up by Dr. Anita Williams and Professor Chris Nestor and myself moving on as an academic. They were all funded by Innovate UK or Technology Strategy Board as it used to be, and the companies. So when I think about integrating research into product, I think about various different things which do overlap, but I've tried to just provide an overview here of how we may integrate footwear research into product design, embedding knowledge within companies, marketing, and consumer information. The FitFlop KTP was in the field of health and wellbeing footwear. It was a shoe that had been designed as an exercise shoe to give you a workout, but they'd received numerous customer testimonials about clinical benefits, and they wanted to investigate these and the technical advantages of the footwear. We did a lot of work looking at comfort in the shoe. We adapted visual analog scales and asked people how comfortable they found the shoe for different areas. We looked at the same kind of technology that Neil's just told us about, looking at plantar pressures. What these were in the midfoot in particular was seen to be associated with comfort and seemed to be very high in the footwear. We looked at shock absorption properties, benchmarking against other instability footwear and also trainers and normal shoes. And we looked at stability. We looked at stability in standing, stability in gait, and we found that the footwear did provide a slight challenge to stability, as we might have expected by the aim of the footwear. So some of the ideas from the KTP and the testing that we undertook showed us that the footbed was basically too large. The yellow shows the area that the foot really needed to cover, and the red, the current shape. And we also found that the depth for shock absorption in the impact testing, it just wasn't necessary. So slimming the footbed down enabled the company to develop a covered shoe. They only had a sandal prior to this, so this was a whole new range for them, which was a real opener for the designers being able to introduce like Oxford brogues. And this is partly, I think, where the company has really developed and continued since we undertook the KTP. Another thing that was embedded really was knowledge within the company and marketing. The pressure images that you can see on these marketing hang tags are directly from our research. And the company went and bought 5 Medilogic in-shoe pressure systems because we were able to teach them how to use them and how to talk to stakeholders using them. So this was quite important for the continued communication and scientific communication with consumers. Moving on to the Tafeln and Weratech KTPs, I've put these together because it's an easier story to tell if we think about them together. This is a workplace footwear. It originally started off in nursing and it's also used in hospitality now. So lots of it is about the demands placed on standing wearers, which obviously we look a lot at gait in our field and biomechanics, but we don't always look at standing. And lots of these standing tasks place a lot of demand on the feet. So the first aim was to look at embedding an applied research function into the company. And the second aim was to look at mass customization, which I'll go on to after we've discussed KTP with Jenny's work. So Jenny looked at undertaking work in office environments and standing environments. So this shows a chef's shift in 12 hours versus an office worker's shift, which is obviously a bit shorter. The yellow shows standing and the red shows sitting. So we can see that a chef, compared to an office worker, is placing a great deal of demand on their footwear. We can also see her gait testing she undertook. We've got an in-shoe pressure system in there again, and she undertook some quite novel work developing standing protocols that could be undertaken in the lab. So she did motion capture and plantar pressure data collections within lab. And this led on to the company identifying that midfoot contact was key, and it was key for comfort in their wearers in standing, and it was key for comfort in the product. So they developed a 3 hardness insole system, which was then tested with wearers, and the qualitative data was collected. And it identified, quite importantly, that people were able to identify themselves as having a low or medium arch, and their self-selection related to foot posture measures. And also that if you ask them a few questions regarding sensation under the feet and preference of footwear, you could actually quite easily predict about 63%, I think it was, of their insole preference. So as I said, this led to a product being developed which hadn't been used before, which was a shoe that the wearers could buy, and they would buy an insole that was either soft, medium or hard to match that. It also led, quite importantly, to the company developing an internal structure called a wearer innovation loop, which is now applied to all their product development. So the KTP embedded this system and process within the company, which they still use to this day, which was very important to them now, always embedding research and wearer evaluation into all product design and development from now on. So Max has picked up where Jenny left off, and he undertook a study looking specifically at chef's foot shape, and he identified that the current insole shape that Jenny had developed was actually not quite matching the profile of chef's arches. So this information led directly into the product development in the company, and it's led to a new product being developed, which is the same sort of insole, but it has a different shape. And as you can see, it also has a different route to sale. To buy Jenny's prior product, people had to purchase an insole and a shoe, whereas now there isn't that difficulty in e-commerce of purchasing 2 things and having to select one preference. People now can buy an insole that has basically Lego pieces that slot in and alter the hardness. And the customization strategy that Max is working on and publishing data on is now looking at how people select that hardness correctly. Final KTP that I will talk through is with Michael at Clarks. It's still going ahead now. Everybody in the UK knows that Clarks is obviously a market and sector leader in children's footwear, and the company has a strong knowledge base, a large knowledge base in children's footwear, but they recognise that this is relatively outdated and it needs improvement, and it needs new modern insight with new technologies and new data. This is based around the 8 principles that you can see along the bottom. And Michael's main aim is to improve the general knowledge under these principles within the company. One of the things that Michael's been able to do is grab hold of data that Clarks already have. So some of the research has already been done, but the company don't really know what to do with it or how to implement it. So he's been able to take iPad data. They used to have an iPad foot measurement system in store, and he's been able to take that data to look at the discrepancy between foot size and shoe size when people come back to have their feet measured and to buy new shoes in store. So undertaking a large foot shape analysis study, which is longitudinal. He's based in a school, so he's able to collect a great deal of data on how foot shape is changing as children grow and age. And he's also undertaking some more product modification studies where he's looking, this one at heel height changes, and some other studies looking at weight and flexibility of footwear and how this influences gait in children. That was a bit of a whistle-stop tour. I apologise for probably either being too fast or too slow. However, my main kind of future directions, I'd say, obviously product customization that Max has been looking at. The development of e-commerce and the development of technologies allows us to get a lot of information about consumers and implement it relatively effectively into product development, such as the wearer innovation loop that Weartech currently use. And for us as researchers, we can have quite a lot of influence by embedding knowledge rather than doing like benchmarking or studies for marketing. It's really interesting for us to be able to really change the way companies work and provide the company with enough detailed information and enough knowledge to change the practices moving forward. I just want to dwell on the reference slide a little bit because I've talked about how these things influence companies, but just to draw your attention to both myself and Jenny Anderson with luck and hope, not hope actually, she's submitting by PhD by publication as well. I achieved my PhD by publication through this route. So it's not just about producing things for companies. We can produce some high quality research and some thorough research, and we don't just have to produce small reports. And just to draw your attention to that as well. Thank you.
That was great. Thank you very much, Carina. Just out of interest, so you work with quite a few different industry partners, and I imagine working with a KTP associate and having to integrate research into their practices really changes their product development quite significantly. Have you encountered any barriers in facilitating that process at all?
Yeah, that's a really good question, actually. Yeah, there are barriers, and obviously every company is quite different. You can see with the Weratech example, the Tafeln example, that they really did grasp hold of the principles and the ideas, and it really changed the way the company works, and will change the way the company works probably for the next decade, which is actually a really powerful change. However, in some companies where there's already a product development process in place, or some companies where maybe there isn't a product development in place, there are more challenges to overcome, and there is a bit of a barrier there. And it's not necessarily that they don't want to buy into it, but it's maybe that they actually haven't done this before, and they don't really know how to, which I guess is part of our role and part of our experience as we continue doing these projects, is that we become better at helping them do that. But I also think if we can position our research appropriately, and we can translate it into something that's more accessible and less numbers on a slide, and more actually, this is how this affects the wearer, and this is how it changes product development, and this is what it means to the next step of the product development process, then we should be able to bring those barriers down ourselves. But yeah, there certainly are challenges in working in companies, but I think we definitely, it's a real privilege to be able to see our work actually translate directly into product.
Yeah, that's really interesting. Thank you. I've got one final question from the questions and answers section, which is from Chelsea Starbuck, and that's asking whether the findings regarding children going to the store for new shoes reflect other geographical areas, given that most of the data is collected in the Southwest.
Yeah, that's a good question, which we don't know the answer to. You can kind of assume, I guess, like some of the data might be slightly different, especially from memory. Some of the data was taken from a Clarks store in Street, which is where their head office is. And it sounds a bit silly, but the community is very kind of based around Clarks, and it obviously has quite a long history in the community. And therefore people might be a bit more informed, or they might have had a little bit more contact with the company, and therefore they might go back to get their shoes checked a bit more regularly, or they might just pop in because they happen to be passing and, oh, we'll just go and get your shoes checked or your feet checked. Whereas somewhere where either the store isn't on a high street in a footfall area, or where people don't have that kind of personal relationship with Clarks as such, and that emotive relationship that some people do have, it might be a bit different. I don't know whether it would reflect too many differences, because we had quite a lot of data, and it kind of might have sifted out the kind of influence of locality, but it might be something that we do look at in future.
That's fantastic. Thank you very much, Carina. I'm going to pass you on to Loz now, as I think we're just about running out of time on this slot. Thank you very much.